And call the meeting to order. Clerk, will you please call the roll?
Agent.
Here.
Clegg.
Here.
Halliburton.
Here.
Sanchez.
Here.
Thompson.
Here.
Woodings.
Here.
All present.
Great, thank you. First up, we've got Eric on Zoom to answer any questions related to the interim budget change memo we received.
Thank you very much, Madam Mayor. We do have 3 interim budget changes for consideration this afternoon, all 3 of which are technical in nature. The first one regarding property taxes is a budget adjustment for the revenue estimates in fiscal year 2021 that is required due to the timing of the receipts from the Governor's Public Safety Grant Initiative. Those receipts from coronavirus relief funds will actually be received in fiscal year 20 versus 21. However, they will be providing property tax relief in fiscal year 21. This adjustment brings down the estimate for property tax relief in fiscal year 21, but increases our estimate of prior year proceeds, reflecting the timing of that reimbursement. The second action is a budget realignment of funding associated with our time and attendance system project, moving it from the IT department into the human resources department. And the third item is a funding acceleration using development impact fee funds from fiscal year 2025 to fiscal year 2021 for the Bowler Park project. And that acceleration will allow the park to be built out in one phase. With that, I'd be happy to stand for any questions.
Yes, go ahead.
Eric, I just have a question on the first one in terms of how we will handle it in the future on trend as we describe trends and history, because obviously it's a big number and would impact those trends a lot.
Thank you for the question, Council Member. I think that what we're going to have to do is essentially include an asterisk. So I think for trending information, we would show the amount before the reduction and then put a footnote to say that it was technically reduced due to timing of the proceeds. But we certainly had considered that as well.
Great, right. I figured you'd thought of it, but wanted to ask.
Thank you.
Madam Mayor, Councilmember Halliburton.
Yes, go ahead.
Hey, Eric, I was just wondering with the Bowler Park, if there's any cost savings by building it out in one phase instead of having to do 2.
I believe that there might be some cost benefit to that. Jennifer Tomlinson, I believe, is on the line, and she might be able to speak to that.
Thanks, Eric. Madam Mayor, Councilmember Halliburton, we are able to realize cost savings on that one in particular because there's a lot of grading that needs to be done on the site. And so we'd have to bring in finished concrete or a finished material anyways, just to ensure that the site is properly graded. So by kind of addressing all of the grade issues through that, we are able to save some money that way and build a super cool skate park at the same time.
Awesome. And then Madam Mayor, just a comment there. I think it's so exciting that we are able to do this in one phase rather than 2 and kind of expedite the process of getting a park. I think it might be our furthest east park maybe that we have in the city. So kind of, really helping us realize that goal of 10 minutes of walking distance. And there's all sorts of paths into all sorts of neighborhoods and a skate park, as Jennifer said. So it's exciting that we're maybe able to do this quicker and maybe save some money in the meantime. So thank you.
Madam Mayor.
Yes, go ahead.
Thank you. Jennifer just reminded me that this is going to have a skate park. Are we going to use the same skate park company that did roads or someone different?
Madam Mayor, Councilmember Woodings, we had it designed by, I believe it's the same consultant that we used over at Rhodes. Obviously it's much smaller, but we did use one of the skate park design consultants on it.
Very cool. Thank you.
Mm-hmm.
Madam Mayor.
Yes.
Seeing no more questions, I move that we approve the interim budget changes as presented on November 10th, 2020.
Second.
We have a motion and a second. Clerk, will you please call the roll?
Sanchez.
Yes.
Thompson.
Yes.
Woodings.
Yes.
Agent,
Yes.
Clegg,
Yes.
Halliburton.
Yes.
All in favor, motion carries.
Thank you. Okay, next up, we have Kimberly Link from the Central District Health Agency to provide a COVID update. Kimberly, oh great, there you are. Welcome. I wanted to say just a couple things before you jump off. One, I appreciate you being here. Council leadership had suggested that you join us. I thought it was a good one so that the public could hear directly from you what we hear regularly these days. And a couple things just for the public to know before we get going. As you'll hear from Kimberly, the numbers aren't good and it's getting worse. And we're hearing now on a regular basis from hospitals, medical professionals, agency, people at Central District Health, that more steps by individuals are needing to be taken. And today I had a call with the state epidemiologist, Chris Hahn, because I am after our call, actually the county call that we had, because I wanted to talk with Chris about what's next, what here in Boise could be done, should be done, because I'm so concerned. Because at the end of the day, it's not just Boise that needs to take steps, but I wanted to know if there were additional steps that we should be taking right now. And she said one thing that I thought was really important for all of us to recognize, and that is that, she said Boise in many ways has done more than it's due. Like, we have stepped out, we've taken action. There are questions about enforcement, and I met with Russ today, the director of Central District Health, to talk about convening a smaller meeting where we can talk strategically with ideally the state, so the governor's office, our police, Central District Health, and medical professionals about what, if anything, Boise specifically can do. But again, he too reiterated that what we're seeing happening right now is, while the numbers aren't great in Boise, they're worse other places. That impacts our hospitals. It puts additional pressures on our community and also puts our community at risk. And so as I have been talking with the public, I'm talking with health professionals and others, and what we're seeing is that, and Kim, I think you'll allude to it as well, our own wastewater data is showing spikes. We need, parents to be, to talk with your kids. I have a daily talk almost with my high school son, Aiden, about what's risky, what's appropriate, and how to stay healthy. We need to avoid gatherings with extended family, especially as the time these holidays are coming up, it's going to be even harder. We are prepared to take additional steps if we must, but I really hope, especially in seeing what the governor of Utah did Sunday evening, that we will see our state take some action to help us, because what's happening in the Magic Valley and East Idaho and North Idaho is putting pressure on our own hospital systems, which reduces the space for our own residents. And that's definitely a concern, but one that we're tracking. And so really appreciate, Kimberly, all the work that you're doing on this, the hard calls that you've pushed us to make, and the time you're taking today to review the data that some of us see, but that we wanted to make sure all of council, as well as the public, was able to see as well.
All right, well, Madam Mayor, thank you. For those of you I haven't had the opportunity to talk with before, my name is Kimberly Link. I'm the manager of the Communicable Disease Control Program at Central District Health. And I do provide a data overview twice weekly regarding what's going on in Ada County to the elected officials. I do have some data to share here today. It includes Ada County data, but then also specific data related to the city of Boise, and then also our hospital situation as well. So I will move forward to share my screen so that you can see the graphs that I pulled together. And can you tell me, can you see what's on my screen right now? It should say a graph of Ada County. Okay, I'm getting a thumbs up. Wonderful. So what I'd like to do is look at Ada County first. And so this is a graph of our probable and confirmed cases by date of report for the entirety of Ada County. And you can see here, we started off, I did start just for the sake of space, I started this graphic looking at May, just ahead of when we saw the first spike in cases over the summer. You'll see those cases went down. In September, we had a really nice, really low case number for our Ada County area, and then started climbing again. And unfortunately, where we're sitting right now, we saw a pretty sizable jump over the past couple of weeks. The most recent week that I have data for, so the week starting 11/1, right now I'm reporting out just shy of 2,000 cases. We are still working on getting some of those cases data entered. So by the time that I do my next dashboard update, I anticipate that number will be in the range of 2,100 cases. So what you can see is that we had quite the sizable jump for the county, going from 1,300 cases to 2,000 plus cases in 1 week period of time. And this unfortunately puts our case numbers much higher than what we saw over the summer. And as Mayor McLean alluded to, this is putting strain on our hospitals, along with what we're seeing across the entirety of the state, and something that everybody should be aware of and concerned about in terms of where these numbers are heading. So the next graph that I have, as we look at specifically at schools, I know that looking at the case rates has been something that has been of particular interest. This is the average weekly case, or excuse me, the average daily case rate based on a week for Ada County. It is different from what the rate that we're using for our schools. It's taking a 1 week period of time rather than our schools rate, which is a 2 week period of time. And you can see over the summer, again, as that benchmark of where we hit prior highs, our high over the summer was a case rate of 44.44 cases per 100,000. In this last week, our 1 week case rate was over 56 per 100,000. So again, seeing high rates, high amounts of illness, and much higher than what we had seen previously. These next sets of graphs, I've looked at two particular age groups that we are concerned about, and concerned for different reasons. The graph on the left looks at the number of cases among residents under 18 years of age. So really our daycare, preschool, and school age population. And we know that when we look at COVID, kids can be very efficient at transmitting the illness, unfortunately. As with any number of respiratory illnesses, a lot of times if a kid gets it, it does get passed on to other people. And that's the same as what we see for COVID. So what you can see previous to the past few weeks, really we didn't have more than 100 kids in any given week that were being diagnosed with COVID. Unfortunately, what we've seen over the past couple of weeks, again, those numbers have climbed, and we saw a pretty significant jump last week where we were over 250 kids having COVID illness within Ada County. And of course, as we look at why that's going on, the question of schools, of course, is top of the list. To what extent are schools playing a role in this? And the answer is not an easy one, especially when we're looking at high rates of illness in the community. So what we're seeing is that there are a lot of kids who are in school while infectious with COVID. And there are other kids who then, about a week later, are being diagnosed with COVID. The thing that's tough to know is whether or not that main exposure happened in the school setting or in the classroom setting. Was it perhaps time spent outside of school? Were kids hanging out after school? Were they studying together? Did they play athletics together? Were they on the same sports team? Did they possibly have family members who were infectious at the same time? It becomes increasingly difficult to tease that out. But what we can say for sure is that we are seeing increased illness in our kids. And, much like what we saw with our young adult 18 to 29 population in the summer, leading to increased case numbers throughout the county, having larger numbers of cases among kids is most likely going to continue to push our case numbers even higher. The graph that's on the bottom right there, this is looking at our residents who are over 70 years and older. And again, the reason we want to focus on this group is that these are our folks who are really at the highest risk for poor health outcomes. So highest risk for hospitalization, highest risk for death. And what you can see again, these case numbers, we topped out with about 135 people within this age group who got sick with COVID over the summer. A number of them were those that we saw hospitalized. Numbers came down again as our case numbers went down in the community. And then starting again, a couple of weeks back, we saw these numbers jump up. And as with that general trend, we're seeing that they've jumped higher than what we saw over the summer. So definitely concerning. These are our most vulnerable populations, the folks that we want to be protecting from COVID the most. And we're seeing increased numbers of illness. And of course, with that, we can anticipate seeing additional hospitalizations, unfortunately, as a result. So I want to move into providing some information that's more specific to Boise. So you'll see these graphs are, they mirror the information that was provided in the Ada County graph, but are specific to City of Boise. So what we see is, again, very similar trends to what we saw for Ada County. We saw increasing numbers of cases going in from end of June into July and August, topping out at just shy of 700 cases being the maximum for the week. Numbers came down, and then again, over the past few weeks, we've seen that week upon week increase in the number of cases. And unfortunately, last week we did see that there were over 1,000 residents of Boise who were diagnosed with COVID. And again, kind of looking at those comparisons between Ada County and Boise, knowing that we have the largest population within the county here, it makes sense that what's happening here in Boise a lot of times is going to be reflected in those county numbers as well. So knowing that those trends are fairly similar is not surprising. And as we move to the second graph here, so this is looking at that average daily case rate by week. And again, what you can see is a similar increase where back in September when those case rates, when we had, looks like our low number was 197 cases the week of September 6th. That correlated to a case rate of 10 cases per 100,000. And ideally, that's where we want to be in terms of looking at those numbers. 10 per 100,000 is a really good, really sustainable place for us in our community. Unfortunately, what we've seen is with those case numbers increasing, those case rates have increased as well. And as we look at the most recent week, again, similar to Ada County, the Boise case rate is at about 55 per 100,000. And as we look at these bottom sets of graphs, so again, looking at our under 18 population and our population of residents 70 and older, very similar trends to what we saw for Ada County with the higher numbers during the peak over the summer in July, and then tapering off into August and September, increases again, and a jump of the under 18 population, number of people being diagnosed with COVID. So again, kind of foretelling of what we can expect to see moving forward, that these kids are most likely going to be leading to increased transmission within the community. A lot just sharing through family contacts, through sharing through friends. And then again, looking at our 70 and older population, we saw, as with Ada County, we saw a similar increase about 3 weeks ago, where we had gone from, under 10 to up to 30 or so cases, and then jumped the next week. That week of 10-18, we had over 100 residents over the age of 70 who were diagnosed with COVID. So again, as we look at our most vulnerable population here, anticipate that as these numbers increase, we're going to see increasing hospitalizations and increased adverse outcomes as a result. So I want to take a minute, since we've talked about hospitalizations in the big picture, to pull up some information specifically for them. So I have two sets of side-by-side graphs to show what's kind of going on with our hospitalizations. This first set looks specifically at Ada County residents who've been hospitalized with COVID. We started collecting this information specifically from St. Luke's, St. Al's, and the Veterans Administration Hospital starting in mid-August. So you'll see that's where this data starts from. And what we can see, again, similar to what's been going on in the community with the number of cases rising, you can see that during during that middle to end of September, our hospitalizations were at a really low point. So sitting in a really good position. And then from there, as our case numbers increased, unfortunately, our hospitalizations have increased as well. The part that definitely gives me the most pause is looking at our number of ICU admissions and knowing that that number is increasing very steadily. What we know about patients who are hospitalized with ICU care is that these are folks who oftentimes when they're hospitalized, they aren't in and out in a day. They're oftentimes needing advanced levels of care for days, if not weeks on end. So as we see increasing numbers of people within the ICU, it's much, much easier to have strain in that ICU capacity versus non-ICU capacity. And that I think is really going to be an indicator for us as we look at our community and our ability to care for those who need the most advanced care to be able to survive COVID. So this bottom set of graphs that I have, again, it looks very similar. These are, however, looking at the total number of patients who are hospitalized in our Ada County hospitals for COVID. So this is looking at the census of St. Luke's, downtown and Meridian, St. Alphonsus, and then the VA hospital. This data we have going back a little bit earlier into the summer. We started collecting this at the end of July. And what you'll see here is that it's picking up those hospitalizations that were coming as a result of the increase in cases we saw over the summer. Again, that number came down again. Total number of hospitalizations went down. ICU care went down. And we've seen, again, with the increase in cases both here, but also with the influence of increasing COVID numbers across the state, that we've seen those increases in hospitalizations as well. And I think this is a good time to point out that when we're looking at COVID hospitalizations, this is something that is typically a delayed response. So what we see for people who are becoming ill with COVID is that they will have typically a mild respiratory illness, can be a cough, runny nose. Sometimes people initially will have some shortness of breath, but when people are getting sick to the point that they need to be hospitalized, that's not happening on day 1 or day 2 of illness. That's happening oftentimes a week, 10 days, 2 weeks, even up to 3 weeks or more after they first got sick with COVID. So what we need to be aware of and think about when we look at how our hospitals are doing is that our hospitalizations that we're seeing right now really are a result of illness that happened a couple of weeks ago. And I think that can be clearly seen with the graph on the left-hand side, and I'll bring my mouse over to it here. So we have this high point of hospitalizations, about 90 on the week of 7/29. And if you look at what was going on in our health district at that point, we were 3 weeks beyond our peak for those summer cases. So we had had a couple of weeks of steady decline in our illness, and yet that's where really we don't start to see the decline in hospitalizations. So as we look at our case numbers rising right now, we are in a position where our hospitals are saying, yep, at this moment we're doing okay, but what we need to be aware of is that anything that we're doing right now, those effects aren't going to be seen by the hospitals for 2, 3, maybe 4 weeks down the line, unfortunately, just because of the way that COVID works. So it's something that we need to be very proactive and recognize that prevention is going to be key to help preserve our healthcare capacity here in the area. That's what I have as far as data. I am very happy to take any questions that you have about our current situation, CDH's role in response. Thank you.
Madam Mayor.
Yes, go ahead.
Thank you. Thank you so much, Kimberly. That's very sobering information, and thank you for being so concise in delivering it. I'm wondering if there's any more demographic information that you can provide to us in terms of who are the individuals who are ending up needing this intense care, and does that demographic information help us determine on how we can help crush the curve, as it were?
Madam Mayor, Councilwoman Sanchez, we do have some demographic information that I include on our dashboard. It is based on health district-wide information. When we look at hospitalizations, there is a very strong correlation to age. So when we look at our under 30 population, very few hospitalizations coming as a result, and those numbers continue to climb with age. What we see is that those who are potentially in their 30s and 40s, we see COVID-related pneumonia. Typically shorter hospital stays are occurring. We do start to see some cardiac involvement, so people who are presenting with heart attacks as a result of COVID, and that's something that we've seen among people as young as in their 30s, and as the population gets older, that's becoming infected. There is an increased risk of hospitalization. In terms of other demographic information, race and ethnicity, of course, is an aspect that we would like to have more information on than what we do. I think we see nationwide that for a variety of reasons, people of color do tend to have worse outcomes from COVID than Caucasians. But one thing that we're hampered by is that we don't have race and ethnicity for a lot of people, so it makes it very hard to provide firm conclusions as far as what that information is, what that data is showing for hospitalizations and adverse outcomes.
Madam Mayor, just a follow up to that.
Yeah.
Do you know what the barriers are to that? I mean, we just have heard over and over again since this has become an issue for us in our state, that is a demographic that has really felt the brunt of this. I'm concerned that we're not gathering that information. What's the barrier to that?
Councilwoman Sanchez, that it's multifactorial. So when we look at the data that's reported to us through lab reporting, race and ethnicity are supposed to be reported. Those are the two data points that should be included with every lab that comes our way, similar to a person's phone number and their date of birth. Unfortunately, for reasons I'm not sure of, a lot of times it's not coming through. Another barrier that we have is that people will decline to provide this information. So even when it is being provided to us, that it's not being given by individuals. And of course, that does beg the question of, well, can you ask it during the interview? And we've looked at that as an option, and just looking at where we need to collect information, provide education. We have not selected that as information to be collecting at this time.
Thank you, Madam Mayor. That's really concerning. I don't know if that has anything to do with the anti-immigrant sentiments that we've dealt with over the last administration, but that is really concerning, and I hope that we're going to take a closer look at how we can gather that information. Thank you, Kimberly.
Madam Mayor, Councilmember Halliburton.
Yep.
Maybe kind of related. I know that we've identified some of our assisted living shelters, Boise State University students, as some of the hotter spots or clusters that we've seen. Have we seen clusters in any other areas that you're aware of?
Councilmember Halliburton, I'm thinking through where we are continuing to monitor clusters that are associated with the prison facilities in CUNA. The Ada County Jail has been working through having ongoing cases in the jail setting, both among the detainees and staff. We are continuing to monitor cases related to staff and students at Boise State. Long-term care facilities, of course, are one of our highest priorities for response related to clusters. And at last count. So that information is published weekly on the state's coronavirus website. There were 34 long-term care facilities in Ada County that are currently being affected. Those are the main clusters that are on my radar for awareness.
And then just to follow up, I guess, with that. So I think one of the things that we've identified is a lot of it's happening at smaller, more intimate, extended gatherings with extended family and groups and stuff like that. Is there a way, do you know if we've done tracing that can tell, are people getting it when they're going and shopping, from other shoppers, from the people who are working, retail, from, restaurants and customers like that? Or is it mostly within our own groups?
Madam Mayor, Council Member Halliburton, that's a great question. And so if we look at the numbers overall, what we see is that about half of our cases, when asked as far as looking at the most likely exposure, it is through somebody that they know, whether that is a family member, a close friend, perhaps a coworker. A lot of times these folks do know where they're getting it from. When we look specifically at spread within a household, I think that question becomes more complex as far as how is it being introduced into the household. So there are definitely instances where these social gatherings, whether it's a small social gathering of a couple of people, or unfortunately one that we're starting to see the results of being Halloween parties, bring the virus into a household. And we see that a number of people are not able to isolate within their household, that they either because of their living situation or through the choices that they're making as a family, that they do continue to have exposure within the household, and so we see spread there. When we're looking at that broader spread within the community, that becomes much more challenging to put our finger on as far as where that cause comes from. Typically, what we will ask people is, to find out if they know of somebody. We might try, we do try to ask about where people were in that period of time. Unfortunately, it's a 2-week window. So being able to provide an hour by hour, I went to the store on this day, and that can be very difficult, especially if we're talking to somebody, a number of days maybe after they have become sick. So what we find is that there is a fair amount of what we call community spread. So this is a situation where we know that the person hasn't traveled outside of the area and they don't know where their most likely exposure came from. What we know is that when our case numbers become so much higher within the community, that risk of community spread increases as well. We think of COVID being an illness that increased duration of exposure means an increased likelihood that you may get sick. And so spending 20 minutes with your best friend over lunch might be enough to cause a person to become ill if their friend is infectious. However, if somebody is out and about all day and they come into short periods of contact with 20 different people who are infectious with COVID, that could be enough to get them sick as well. So it does become complex, and it becomes challenging to be able to put our finger on what's causing transmission within the community.
Thank you for that answer.
I have a question that has nothing to do with policy, but I just got super curious. So is there research that's been done is there a difference? Does COVID, if you were looking at the genetic makeup or whatever it is, the makeup of the virus within a person, does it look different if the person gets it from one person versus getting it from the exposure to 20 people? Or is it all the same?
Madam Mayor, that's a great question. It's something that I would have to look into.
Okay, you don't need to. I don't want to make work for you. I just suddenly got really curious about it, but thank you.
Madam Mayor, this is TJ.
Yes. Is that TJ? Councilman Thompson, or was that Councilman Halliburton again?
That's me, TJ.
Okay.
Yep.
Great, go ahead.
Yeah, thank you, Kimberly. I really appreciate this. You taking the time, the information, while sobering. It's extremely helpful to me to understand the direction we're going as a community. I was curious, when you're talking about the 18 and under age groups, is it hit a certain ages harder, or I mean, are they more susceptible to getting it at the higher end, closer to 18, or is it irrelevant? Thank you.
Madam Mayor, Council Member Thompson, I think that is all ages of individuals, I think, are equally likely to get COVID. One thing that we see, though, is that younger kids do tend to have milder symptoms or no symptoms at all. So what we see with teenagers is that they will have respiratory illness. Our younger kids, maybe not so much. So that's one of the things that makes it challenging when we look at preventing the spread of the illness among our younger kids, among families, is that there is that increased risk of spreading the illness without even having any awareness that a person's infectious.
Thank you.
Yes, go ahead.
Thank you. Thanks for being here today, Kim. It's really helpful, I think, to make sure that our public is aware of this information, as well as the rest of the city council members. Today on the call, you noted that, or someone did, I can't remember who, that testing is again becoming a little bit more difficult, that in some instances we're going back to only symptomatic testing. Can you talk a little bit about that? And from our standpoint, is there anything we could do to help procure more tests or help ensure that they're more available?
Madam Mayor and Council Chair Clegg, that I believe that was brought up by a representative from St. Luke's, that it was in the context that they are providing symptomatic testing. The only asymptomatic testing that they're providing would be for pre-surgical services, so for those individuals who need to be tested ahead of a surgery. As we look at testing availability, it is, I think, limited for a number of reasons. One being the technology that's available, and even though we are seeing that the machines are becoming more readily available to do the testing, oftentimes the reagents are coming in short supply. I know I talked with a clinic just this week that they said, you know, hey, we're able to do the testing, but we don't have the cartridges to be able to run the test, so we're having to send everything out. Another thing that we're seeing that's causing impacts on testing is that we're seeing increases in our number of healthcare workers who are becoming infected with COVID, and that's causing issues with our healthcare system in terms of being able to staff clinics as well. As we look at that, that's not necessarily people who are getting sick because they're testing for COVID. Our healthcare workers are just like every one of us as well, that they live and work within the community and are potentially being exposed from friends, family members, and potentially colleagues at work, as are most everybody else right now.
Can I follow up, Madam Mayor?
Of course.
So a little follow-up. I asked this question because recently one of my family members was exposed briefly and decided that it would be, best to get testing for they and their children. It was really difficult to find that testing. Ended up driving to Nampa in order to get it done anytime soon. I know that there are a lot of people in the community who would fail to follow up if it were that difficult to get a test. So is there other recommendations that we should be making? I know that, or at least we've already made them, but really focusing on, if you can't get a test, really quarantine for those 14 days, because I suspect there are people who know they've been exposed and they're finding it difficult to get a test. And I'm not sure they're following up on the procedure that they should, if that's the case. What should we be telling people?
That's a great question, Council Chair Clegg. And what people really need to know is that being able to get that test is helpful in the process, but what we see is that if you've been exposed to COVID, doing the full 14-day quarantine really is the best way to prevent transmission. unfortunately, what we see is that oftentimes somebody will get exposed and they may go to a clinic the next day and get testing. And that's honestly, it's too soon to know whether or not you've actually been infected with a virus. If somebody is getting tested after an exposure, that really should be at least 4, if not 5 or 6 days after the exposure. But we know that a person can become sick with COVID up to 2 weeks after exposure. So that's why it's important for a person to quarantine for that full 2 weeks after an exposure.
Thank you.
Are there other questions? Comments?
Madam Mayor,
Yes, go ahead.
thank you so much for being here today, Kimberly. It's nice to see your face and not just hear your voice on our calls. I wanted to just ask you, as a practical matter, say you were in a family that had folks who, had jobs where they had to go to work and also kids in school. What would be your practical advice for keeping your family safe during this time?
Madam Mayor and Councilmember Whittings, I think that's definitely a situation I know many people are in right now. And every family, I think, needs to look at their own personal situation and assess what risks they can potentially cut out of their lives right now. So, we are recognizing that it is uncomfortable. It's not nice to say, I can't do this because of COVID. However, going back to some of those things that we did in March, where if we need to go to the grocery store, have one person go to the grocery store versus the whole family. Look at, can social gatherings, can those be done distantly through venues like Zoom? And how do we limit those exposures to people outside of our home? For those that have to go to work, look at how you're interacting with your coworkers. Now's maybe not the best time to drive with a coworker for 15 minutes in a car to go get lunch and sit together without a mask on. Unfortunately, that is a risky scenario, and that's one where we're seeing people get sick. And working with your kids, having those conversations about how to safely spend time with friends, so that we can look at taking those steps to get our case numbers to come down. Again, when we look at what happened over the summer, we saw that changes happened in our rates of infection when people really did take that step back from the social gatherings. I think we've kind of relaxed on that a little bit, and people have been getting together. Now's the time to look at that again and look at how to spend more time in person and closely with your direct family, but maintain those other social bonds in non-physical ways.
Madam Mayor, just want to follow up.
Yeah.
I know that probably every single person's heard it, but I think it's always a good reminder. What does it look like to stay safe, like on a really practical basis?
Councilmember Whittings, that there are 2 simple steps in looking at that, and that is to wear a mask or a face cover when you are around other people, and when at all possible, try to stay 6 feet away from individuals. And those are the 2 best things that people can do to prevent becoming exposed to COVID, or if you are infectious yourself, if you haven't become sick yet, that's your best prevention of passing it on to others.
Thank you, Kimberly.
Mayor, since we have a little bit of time, could I ask one more quick question?
Yeah.
Kim, this is really not a policy question yet, but maybe come on in the future. And I don't know if you've begun doing any data gathering on what you might call the long haulers on COVID. I am acquainted with a couple of people who've had various disabling symptoms for over 4 months. And I think looking forward, it's going to be a challenge to understand how many of our community members we may have to help, not just now through this crisis, but maybe for a lifetime because of the damage that was done by this. Do we have any idea yet how that's shaking out?
Madam Mayor, Council Chair Clegg, that's not something that we have been tracking at Central District Health. Right now, our focus has been working with individuals essentially during that first 2 weeks after they've become ill with COVID. So getting them through that initial 10-day period. I think that as we look at what this is moving forward, and especially as we move past this initial response, there might be opportunities for people to enroll in studies to learn more about what the situation looks like, or perhaps registries that people could become a part of to be able to gather information. Because you're right, this is a situation that we don't necessarily know what post-COVID looks like 5 years after an infection. And so we have the long hauler individuals who continue to have those symptoms, but we also know that this is a virus that can affect a person's heart, it can affect their lungs, and we don't know really what that looks like in terms of the long-term ramifications.
Thank you.
Madam Mayor, Councilmember Halliburton, if there's a couple more minutes.
Oh, sorry, my mic wasn't on. Go ahead.
I know that Central District Health hired a refugee liaison not too long ago. I'm wondering if that's been effective, if we can tell that's been effective, and if there's anything that we can do to provide additional communication to that community, or if we feel like we're doing well there.
Madam Mayor, Councilmember Halliburton, we did hire an individual to serve as our refugee liaison. I unfortunately, working on the EPI side of things, don't have as much direct interaction with him. I know that he's part of our incident command group and does interact with various groups within our refugee communities. I think that I would be happy to take your question back to our liaisons to see if there is any additional assistance that could be welcomed.
Perfect. Thank you, Kimberly.
Well, Kimberly, I appreciate you being here tonight and sharing what is really sobering news with all of us. And, we've taken some steps just in the last, it's probably been 2 weeks now, at the behest of Interim Chief Gervais at the fire department, based on studies that, he's looked at and reminded us that even just masks or no masks in 6 feet, if you're in a room for a long meeting, really isn't enough these days, given the rate of spread out there. And so at least our office and department heads and others in the city have started now with all of our meetings were masks. So we really have changed our behavior just in the last 2 weeks, even internally. While we've had requirements that employees be masked when outside of their office, if we've set up space where people are 6 feet apart, we've allowed those masks to come off. And now we keep the face coverings on in all of our meetings. And because this really is, as you said, there are two things we can do in that space and cover our faces. For what we would love to think is a short amount of time, it might be longer, but I also often tell my kids and others that as long as we spend our time chasing normal gets further away. And so we have to make sacrifices. Our kids can't have normal if we ever want them to have normal, is how we've talked about it in our house. And it's hard, it's really hard. But the data is showing that, winter is coming and what we're experiencing right now is really serious. So I'm working with you, medical professionals. I hope the state will be able to come up with some solutions that really can curb that spread so that the hospitals see the differences they need to see in 3 weeks to a month before it gets worse.
Madam Mayor, thank you for having me today. It sounds like the steps that you're taking are very prudent and very timely for what's going on right now. And I think these are things that every workplace needs to look at right now, is how do we work and how do we live in the safest space possible. So thank you.
Thanks so much. Do stay healthy, be well, and I really appreciate you joining us tonight.
Thank you. Good night.
Take care. All right, with that, I think Kimberly we do not, do we have an executive session? No, we do not have an executive session. So now we're adjourned until 6 o'clock.
Issues.